Your body is telling a story right now, in this very second. So today, we're going to decode what stress is really doing to you, and we're going to uncover some pretty surprising clues hidden in your own heartbeat.
Of course you have, right? That feeling of being totally overwhelmed, tense, irritable. It's pretty much a universal part of modern life. But what if that feeling is more than just in your head? What if it's leaving a physical mark, one that you can actually measure? All right, so first up, let's talk about what scientists call the hidden cost of chronic stress. This isn't just about having a bad day. It's about real, tangible consequences for your long-term health. Get this. Massive studies show that people with stress-related disorders have a 30 to 70% higher risk for a whole range of cardiovascular diseases. Yeah, we're talking heart disease, stroke, even heart failure. This is not a small number. It's a huge public health issue that could be affecting you right now. So what's the deal? What's the mechanism behind all this damage? Well, scientists have a great term for it: allostatic load. Just think of it as the price your body pays for being on high alert for way too long. It's the cumulative wear and tear that builds up over time. It's like this. Imagine driving your car everywhere, but with the pedal slammed to the floor. Eventually, the engine, the tires, the whole system just starts to break down. That's exactly what allostatic load is. It's your body's stress response system being stuck in overdrive, and that constant pressure leads to real damage. Okay, so if this damage is happening under the surface, how do we even know? Is there a way to measure it? Is there some kind of internal stress meter we can look at? Well, the answer is yes, and honestly, it's fascinating. To find this meter, we have to look under the hood at your body's master control panel, the autonomic nervous system. This is the part of you that runs all the automatic stuff: your breathing, your digestion, and most importantly for us, your heart rate. Probably the easiest way to wrap your head around this is to think of it like a car. You've got the sympathetic system. That's your gas pedal. It revs you up for fight or flight. And then you've got the parasympathetic system. That's your brake. It slows you down, helps you rest and digest. In a healthy person, these two are in this constant, really delicate dance. So the big question is, how can we tell if that gas pedal is stuck down? How do we measure in real time whether it's the fight or flight system or the rest and digest system that's running the show? And the answer is heart rate variability, or HRV. Now, this is important. It's not your heart rate, but the tiny millisecond-level variations in the time between each heartbeat. This subtle little flutter is a direct, non-invasive window into that dance between your gas pedal and your brake. It really is your body's stress meter. And here's what it tells us. A high HRV, which means lots of variation, that's a sign of a healthy, adaptable body. It means your brake and gas are working together beautifully. But a low HRV, well, that suggests a more rigid, less adaptable system. It's a sign that your gas pedal is stuck on, and it's directly associated with that allostatic load, that wear and tear we were just talking about. Okay, so that might sound a little scary, but here is the really good news. Because we can measure the problem, we can also measure the solution. So let's talk about the power of actively hitting the brakes. The physiological antidote to that fight or flight stress response actually has a name. It's called the relaxation response. And this isn't just about, feeling calm. It's a specific, measurable state your body can enter. It's a state where your body restores its balance. And how does it do that? It's characterized by an increase in activity in that parasympathetic brake system. You are literally physically hitting the brakes. So how do we do it? How do we deliberately activate this relaxation response and start improving our HRV? Let's dive into the evidence-backed tools that can help us out. The research really points to 3 super powerful, evidence-backed tools that pretty much anyone can use: controlled slow breathing, meditation and mindfulness, and good old-fashioned physical activity. Let's break them down. First up, slow breathing. This is maybe the most direct way to kind of hack into your nervous system. The science is so clear on this. Intentionally slowing your breath down reduces feelings of anxiety, and it consistently and directly improves your HRV scores by firing up that brake system. Next, meditation and mindfulness. When scientists do these huge systematic reviews where they analyze all the best available research, they find these practices lead to significant improvements in anxiety and depression. But again, it's not just in your head. They also create real, favorable changes in physical things like blood pressure and, of course, heart rate variability. With long-term practice, it's not about just being totally blissed out. It's about achieving this state of relaxed alertness, a calm, focused, and incredibly resilient state of being. And finally, we can't forget physical activity. I mean, this is an absolute cornerstone of managing stress and boosting your heart health. Regular exercise literally trains your heart and your nervous system to be more resilient. It lowers your resting heart rate and directly increases your baseline HRV. And I know what you might be thinking. I don't have time for this, but check this out. Research from 2023 shows that just 11 minutes of brisk walking per day can lead to meaningful reductions in cardiovascular disease risk. That's it, 11 minutes. What an incredibly powerful and doable starting point. Okay, so let's pull all these threads together. We've seen the problem, we've found the meter, and we've opened up the toolkit. So what's the final takeaway here? Here it is in a nutshell. 1. Chronic stress isn't just a feeling, it creates real wear and tear on your body. 2. Heart rate variability, HRV, is a powerful way to actually measure your body's resilience. 3. Higher HRV is better. It's a sign of a healthy, adaptable system. And 4, and this is the most important part, this is not your destiny. You can actively improve your resilience using these simple, powerful techniques. So look, your heartbeat is telling a story every single moment of every single day. A story of stress, of recovery, of resilience. Now that you know how to listen to it, the only question left is, what story are you going to help it tell next?